Invacare has been established as a leader and innovator in pressure ulcer prevention for over 20 years. By using our experience and knowledge in this area, we work with clinicians and academics in an aim to reduce pressure ulcer incidence within acute and community environments. These close working relationships have helped us to understand the elements required to strike a balance between resource, budgetary constraints, clinical efficacy and ultimately quality of care. Our approach involves working with a range of disciplines to assist healthcare professionals achieve their objectives, whilst working to current legislation, the latest clinical guidelines, NHS initiatives and understanding trust-specific protocols. We are committed to working with you to reduce pressure ulcer incidence and support infection control regimes through the selection of appropriate support surfaces. We aim to help you make equipment cost savings and assist with training on appropriate care and maintenance of our products to ultimately extend their life. By monitoring the effectiveness of your equipment selection in line with your pressure ulcer reduction strategies, we can also help you reach your KPIs. To assist you in these strategies, Invacare has designed a simple yet effective approach to equipment selection. Our three-tier care management model helps to ensure patients are prescribed appropriate pressure reducing equipment and offers an uncomplicated approach to equipment selection in line with these risk factors and vulnerability. This patient is representative of a large proportion of hospital inpatients. He was fully mobile before being admitted to hospital, but now has restricted mobility due to recent knee surgery. He uses crutches to mobilise but can otherwise transfer and change his position independently. He has no existing tissue damage but is currently considered to be at risk of developing pressure ulcers. The Softform Premier is the first line of defence against pressure ulcers and has been designed for modern healthcare environments. The mattress includes a number of predominant features. The first is the 360-degree zip with a double welded flap to maintain integrity of the mattress foam. This multi-stretch cover has a 5-year warranty. The second is the firm foam U-core with side formers which aid patient transfer. The third is the unique castellations which have been stringently dimensionally tested and clinically trialled to offer effective pressure reduction and reduce shear and friction forces. Smaller foam cells by the heels offer additional support for this vulnerable area. By using market-leading foam elements, we can confidently offer a 10-year warranty on the foam against bottoming out. As this patient falls into the at-risk category, he will benefit from being nursed on a high-quality pressure-reducing surface that aids transfer to allow mobilisation early in his rehabilitation. This surface reduces the risk of shear and friction, particularly in the heel and sacral area where he is most vulnerable. As nursing staff are able to check integrity and replace component parts with ease, he can have the confidence that the surface he is on remains safeguarded from infection and is clinically effective. This patient has had a recent fall at home when she was alone and developed a superficial ulcer on her hip as a result. She has had surgery to repair a fractured femur and uses a Zimmer frame to transfer with assistance. Her needs are greater than the previous patient and she is considered to be very high risk. The Softform Premier Active 2 uses novel technology to provide the comfort of a static foam mattress with the therapeutic benefit of alternating pressure. This mattress has a number of predominant features. The Softform Premier Active 2, which is based on the Softform Premier, offers clinically proven pressure reduction as well as effective infection control. The second element is the dynamic insert which sits under the foam. This combines additional pressure reduction with pressure relief. The third feature is a stable foam surface which gives optimal comfort to the patient to reduce the incidence of motion sickness as well as aiding transfer. The fourth and final element is how the mattress can be quickly and easily stepped up to an alternating pressure system by simply attaching the pump. This avoids disrupting the patient and reduces manual handling risks, as there is no requirement for a transfer from static foam to a dynamic system. In addition, there is no need to wait for an alternative mattress to be ordered and delivered to the ward. This means that clinical intervention can start immediately. The Softform Premier Active 2 mattress system combines the benefits of pressure reduction with the therapy of pressure relief. As this patient transfers with the help of a walking aid, the mattress will provide stable support. It is comfortable and quiet and will assist in her rehabilitation process by providing optimum conditions to aid rest and sleep. The mattress will also provide therapy for healing her existing pressure ulcer and at the same time prevent further skin breakdown on other vulnerable areas. Compared to alternative air systems, any signs of motion sickness are likely to be reduced. This will assist with nutritional intake and therefore promote tissue repair. This patient is very poorly. He suffered a CVA and has existing deep tissue damage to his sacrum and left heel and is completely immobile. He is representative of a group of hospital patients who are considered to be very high risk. He is also diabetic, adding to his risk. Following over 20 years of research into the link between technical features and clinical efficacy of dynamic mattresses, the Softair has been designed to incorporate the most desirable features, making this a highly clinically effective product which offers significant cost savings. The predominant features of this mattress include a 3-cell system that provides accelerated healing and encourages microcirculation, 5 low-pressure microcells in the heel area, providing therapy for the delicate heel tissue. The hinged back improves profiling and reduces shear and friction. An easy to operate and quiet pump make for an undisturbed sleep pattern for the patient. Individual cells can be quickly replaced, making this a very cost-effective mattress. As this patient falls into the very high risk category and has existing pressure damage, the requirement from this mattress is accelerated healing. Additional protection is also offered in the vulnerable heel area as he is immobile, making this an area of elevated risk. The Softair pump needs little staff intervention, which will allow the patient longer periods undisturbed, which will in turn aid his rest and rehabilitation. These combined benefits means that the Softair will help accelerate healing, reduce the patient's hospital stay and limit the expenditure on associated interventions such as dressings and additional nursing care. Invacare's three-tier care management approach offers proven clinical benefits for the care of all patients. We offer one of the most comprehensive and cost-effective selection models available. This approach is a complete solution to pressure ulcer prevention and treatment.